Watch this full series at the links in the description below and subscribe to our YouTube channel to watch new mental health videos every week. Hey YouTube, Kyle Kittleson here with MedCircle. Make sure you subscribe to this channel as we release new mental health videos every week. I'm here with Dr. Oreck. Oh, excuse me, and Callie the lab, can't forget her. Dr. Oreck, give a brief background as you are brand new to MedCircle, and I would love for our viewers to know who you are.
I'm Dr. Sarah Oreck. I'm a reproductive psychiatrist, and I work out of Los Angeles. I have a private practice there, and I trained at Columbia University in a women's mental health fellowship.
And you just spent the last few hours blowing my mind on perinatal anxiety, a topic that very few people fully understand, and if they think they do, it's almost like, you don't fully understand it, even when you think you do.
You could always use more knowledge.
Yes, so on very high level here, what is perinatal anxiety?
So perinatal anxiety is an umbrella term, and perinatal, let's start with that. That means during the pregnancy and in the postpartum period. So it includes all of that because most women that have symptoms in the postpartum period start to have them in pregnancy. And it includes anxiety disorders like generalized anxiety disorder, post-traumatic stress disorder, PTSD, obsessive-compulsive disorder, and panic disorder.
And when most people think of pregnancy, they have heard of postpartum depression, but you don't hear the terms PTSD, OCD, panic disorder thrown around that much. So I'd like to go through the four that you just mentioned. I know, dear, we're going to get there. The four that you just mentioned so that viewers have a better understanding of this. Let's start with generalized anxiety disorder.
So this is sort of those worries that something bad is going to happen. And when you have a new baby, it can be a lot of worries that something harmful is going to happen to your baby, or that you are somehow going to harm your baby because you can't take care of it. A lot of worries and checking behavior sometimes. That sort of spills into obsessive compulsive behaviors though.
Yeah, they're all four are interconnected.
Yes.
When we talk about generalized anxiety disorder, which we've done on MedCircle a lot, all right, Callie's got to go, we understand that. But when we talk about generalized anxiety disorder, when it comes to an expecting mother or a brand new mother, how does it manifest differently? Yeah,
so I think what's really important is that anxiety is a normal feeling that happens when you have a new baby, but when it impairs your functioning is what we're talking about. And for a new mother, it can include similar symptoms to what we know as for generalized anxiety in non-pregnant or postpartum populations, but we're really focusing on that relationship with the baby, the checking behaviors, worrying that something really bad is going to happen, that your baby might be sick, even though your pediatrician tells you that she's okay.
That's right. Dr. Oreck and I have filmed an entire series on perinatal anxiety. You can access it at medcircle.com, but I want to give you an inside look into the series. Take a look. You mentioned, though, and I think it was off camera actually, you said that new mothers often have obscure thoughts, like, what if I drown my baby? Or what if I drop my baby? That doesn't necessarily mean they need to go to a psychiatric hospital.
And that's an intrusive image. Sometimes they come as images, thoughts, and so that doesn't necessarily mean it, but it has to be someone who's sort of familiar with what the symptoms are in pregnancy to feel comfortable with that. So there's been some cases of women being locked up in a psychiatric unit because they voiced, hey, I'm having these weird images and I'm really scared about it. But scientific evidence and clinical evidence shows that if you're disturbed by those images, what we call ego dystonic, it's very unlikely that you are going to hurt your baby. Right, so you're scared of those thoughts.
Yes.
Right, that's very different from having a delusion that your baby, is possessed or has, that's very different.
Yeah, some people just got scared though because they heard that you're gonna get locked up into a psychiatric ward if you mention that you're having these thoughts.
What's really clear to say is that I don't want to harm my baby, but this is the kind of ideas that I have. I hope that people are more well-informed, and mostly providers are more well-informed, that this can be a symptom. But of course, if there's a combination of symptoms that are really worrisome, like you're not getting out of bed or you're not leaving the house, those together might be sort of an indication that you should go to a hospital.
Got it.
And some can be voluntary admissions.
Yeah. Again, you can watch that entire series at medcircle.com. Now let's move on to post-traumatic stress disorder. Not a term that many people hear when it comes to pregnancy, but it's something that can happen.
Yeah, birth doesn't always go the way we planned. And a lot of women have birth trauma that they're just not talking about yet. And so these can result in symptoms similar to what we see in PTSD from combat even, of flashbacks, nightmares, or just these intrusive images or thoughts about all the medical interventions you had. And it can really spill over and be difficult in the postpartum period when you're taking care of an infant and thinking about all the things that happened to you, or potentially your baby had a medical intervention. So it's really important to start talking about it a little bit more.
And if this is your first child, you have nothing to compare it to.
Nothing.
You might just think this is how pregnancies and births go,
Right.
when in actuality yours might have been a little more traumatic than somebody else's. Let's move on to obsessive-compulsive disorder. Again, something we've talked ad nauseum about on MedCircle, but not so much when it comes to pregnancy.
And what's really interesting in sort of what you said before is that a lot of the perinatal anxiety just includes little slivers of each one. It's not a full-blown OCD disorder like maybe in non-pregnant and non-postpartum patients. So that's important to know. But some of the characteristics that we see are the checking behaviors, or the rituals around feeding, or if things don't go exactly how you planned during the day, something's gonna go wrong with your baby, or there's something bad that you did. And so it's those thoughts that just can't leave your mind, and followed by some compulsions or things that you just have to do to relieve that anxiety. So a great example is being so fearful that your baby is gonna die of sudden infant death and going and checking every 2 minutes on the baby.
Right. And this can occur, these symptoms of OCD can occur in a woman who's had a baby, even if she's never experienced symptoms of OCD prior to this.
And that can make it so alarming and difficult, right? If you already have a diagnosis of OCD, you're like, this seems familiar, or I'm having these weird, intrusive, violent images. That's not something I ever would do to anyone or my baby, but it freaks me out. And I think people that have experience with that know, oh, I know what this is. This is an intrusive image. I'm not gonna harm anyone. That's the scariest thing scariest thought I had. So it's really, sometimes it just happens for the first time, but it can be so confusing and scary for moms to admit to other people.
That's right. And what we talked in this series on how I don't like it when people go, oh, my goal is to build awareness. And I go, awareness, we need to take action. But in this case, this awareness plays such a critical role, because just being aware of, am I checking the baby every 2 minutes? Is this attached to some sort of obsession that I have? That can start leading you down the right direction.
Exactly.
Panic disorder. What is that, and how does it relate to or perinatal anxiety?
So panic disorder is when you're having panic symptoms. So this is jitteriness, shortness of breath, or just this feeling that you might die because your anxiety is so overwhelming. People often feel like they're dizzy, or they're nauseated, or that things just they're gonna have a terrible outcome of some sort. It's usually very short term, but the effects of sort of all of that adrenaline and all those stress hormones can last for a while. And it becomes a disorder when you have a certain amount of panic attacks with some frequency. Sometimes they come out of nowhere, which is really scary, but people feel sometimes that they're having a heart attack, and they often go to the hospital and they're told actually it's panic. And so this can happen because some people have a lot of physical manifestations to their anxiety. And of course, women have gone through so many changes in their body, so many hormone changes. Potentially you had a surgery if you had a C-section. So a lot has been going on physically. And for some women, symptoms of anxiety or depression are just more physical. And so this can certainly be a component. It doesn't have to be a full-blown panic attack. For some women, anxiety is like a lot of stomach pain or headaches constantly.
Well, I want to make sure that we never over-pathologize anything here, because it's very easy to take one little instance of anxiety and then watch this video and go, oh my gosh, I must have this. What is normal, healthy anxiety when it comes to pregnancy?
Yes, so it's totally normal. Anxiety is not always a psychiatric illness. It's normal and biological for you to want to take care of your infant who can't care for herself. And so of course you're going to be aware of have I fed her? Is she okay? Is she breathing? Especially when you get to know an infant. So that is normal. If you share that with your partner or with your family. When it starts to become a disorder is when you can't function anymore because of those worries. You don't leave the house anymore. If you've returned back to work, you stop going to work because you can't bear to leave your child with someone else because you think the caretaker is going to do something or isn't going to be able to manage her. And so it's really the level of functioning that's so important. And I don't want to over-pathologize anxiety. Anxiety can be helpful.
Yeah, it is helpful.
If we didn't care about our babies, they wouldn't survive.
That's right.
But I think sometimes things sort of go in the wrong direction and women really need help because it's interfering with the joy that they can get from having a baby.
Yeah. Well, Dr. Oreck explains that 80% of new mothers will experience something called the baby blues within the first 2 weeks of having their brand new baby. And this series on perinatal anxiety is really something for not only mothers who are expecting, but also new mothers or anyone who is a supporter of a new mother. So much of our series was for the husbands, was for their friends, was for their other people in their lives who are wanting this person who's a mother to really, really succeed. And within this series, we talk about the treatment options, the different types of therapies you can use, the different types of medications you can use, whether you are pregnant or not pregnant. Fascinating discussion there. A lot of supporter strategies and resources, what causes and what are the risks associated with perinatal anxiety. Again, that's the generalized anxiety disorder, PTSD, OCD, panic disorder, or the combinations therein. And of course, the symptoms of perinatal anxiety, how you can spot those in yourself. We talked a bit in the series about how a lot of these new mothers are obviously preoccupied with this huge life change that they don't even realize that they are suffering silently without knowledge. But we're bringing that to light.
Yeah, and I think it's really challenging. Sometimes we idealize our parental figures and think, oh, our moms did everything, right? And I think really being more open that it wasn't all easy, right? There was a struggle, or there may have been more supports. Maybe mom didn't work, but you do, right? There's a lot of different circumstances that make every sort of postpartum period or pregnancy different. And so we're all experts sort of in our own experience, but it's really important to understand that other people have different variables.
My biggest takeaway, you said, and it might sound obvious, but I think sometimes the biggest takeaways are those really obvious ones. You said, you do not have to choose between being a good mother and taking care of your mental health. That is so great. Thank you, Dr. Oreck, for being here. Thank you so much. And thank you for Dr. Oreck's mother for being here. I mean, we're talking about mothers, so we got mothers here, we got the expert. It's really great. Thank you guys for watching this video. Make sure you subscribe to this channel. Leave us your comments below. We always like to know what you think MedCircle should be doing better or what your big takeaways are from our series. Head over to MedCircle.com to check out Dr. Oreck's series with us on perinatal anxiety. I'm Kyle Kittleson. This is Callie the Lab. Remember, whatever you're going through, you got this. Thanks for watching. If you liked what you just saw, then why not subscribe? Click right here for new episodes and new series every week. And to access exclusive mental health videos that we only release at MedCircle.com, check out the links below.